You're live.
Good evening. Welcome to tonight's Facebook Live video chat. My name is Kanika McNeil, and I am the Senior Director of Education and Diversity Engagement for the Crohn's and Colitis Foundation. April is National Minority Health Month, which focuses on raising awareness about health disparities among communities of color. The foundation recognizes the disproportionate impact the COVID pandemic has had on communities of color and the need for IBD patients who are a part of these vulnerable communities to get vaccinated. I myself, I'm actually a patient, and I've had Crohn's disease for 19 years. And so I'm really excited to be a part of this discussion tonight in an effort to really learn more information from Dr. Quezada as well as Christian. So tonight, who will be joining us? We have two wonderful individuals. We have Dr. Quezada, Dr. Sandra Quezada from the University of Maryland School of Medicine, and IBD patient Christian Lawson to discuss health disparities among IBD patients of color and COVID-19 vaccines. Dr. Quezada and Christian, thank you for joining us tonight.
Thank you so much for having us.
Yes, thank you so much for having us on tonight.
Great, so I'm looking forward to a wonderful discussion. So we have a lot to cover tonight, and unfortunately we have a short amount of time, so we're going to try to get in as many questions as we can. So as a reminder to our attendees, the information provided tonight is only for informational purposes. It should not replace any advice that you receive from your healthcare team. If you have any questions about your specific care, please reach out to your healthcare provider. If you have any other questions regarding IBD, unfortunately, we won't be able to address them tonight, but we encourage you to contact our IBD Help Center at info@crohnscolitisfoundation.org or 888-MY-GUT-PAIN with any questions you may have. Lastly, if you're watching tonight, please comment in the chat box. Let us know who you are. Tell us where you're from. We want to hear from you. So now that that's all out the way, we want to jump straight in. So Dr. Quezada, I'm going to start with you. Can you describe COVID-19 and how vaccines work to prevent the spread of the virus?
Sure, absolutely. So COVID-19, I think is, most of us are starting to get more familiar with now than maybe a year ago, is an infectious disease caused by a virus called technically the SARS-CoV-2 virus, which was a new form of a coronavirus. So there are other coronaviruses out there. This was a new form of that kind of coronavirus. So the COVID literally is broken down to co for coronavirus. The VI is the virus and D disease. So coronavirus disease, and the 19 because the first outbreak was in late 2019. So that's why we call it the COVID-19 disease. And as many of us know, this viral infectious disease tends to wreak havoc in the respiratory system primarily, although it has a really broad range of symptoms and even organs that can be affected. We know that some people can be completely asymptomatic. Others can have symptoms like changes in their sense of smell or taste. Many get sort of a lot of the kind of cold symptoms of cough and congestion, and then compounded with fever, chills, muscle sores, as well as potentially even diarrhea is a potential rare symptom of this infection. Another thing that I think is important to note is that we generally often think about it as an acute illness, which again, going from anywhere from asymptomatic to very severe critical illness that obviously can result in death. It also, though, what we're seeing in some patients even can have some more long-term chronic effects. Some people are reporting even after the infection seems to have cleared, some ongoing issues. So it's definitely a disease to be avoided at all costs, and all the protective measures that we've been given are hopefully things that we're all taking part in to avoid contracting this disease. Oh, and then the second part of your question about how the virus, how the vaccines work to help our bodies fight this virus. So there are mRNA vaccines like the Pfizer vaccine, the Moderna vaccine, Johnson & Johnson is what we call a viral vector vaccine. So if you think about vaccines that we're all sort of used to getting, like say the flu shot, for example, those are more often the viral vector kind of vaccines. So it's a similar technology with the Johnson & Johnson vaccine, whereas with the Pfizer and Moderna, they're using what's called mRNA technology, which is a really cool technology that's actually existed for decades, but has been shown to be able to generate vaccine much more efficiently in the lab. This is why these labs were able to come up and produce these vaccines a little bit faster than the Johnson & Johnson vaccine. But importantly, what the vaccines actually do is they give your body sort of like the recipe, the message that indicates and teaches your body how to create the antibodies that it needs in order to fight off an infection. And I know that sometimes, especially when people hear mRNA, they get uncomfortable because they kind of appropriately and understandably associate that with your DNA and kind of wonder, well, wait a minute, is this going to change my DNA or something like that? And actually, that's definitely not the case. I think an analogy that I like to use is to think of your DNA is sort of, this is your kitchen, okay? So in your body, you have a kitchen, you've got your appliances that you need to cook, and you also have ingredients there. And so when we want to make antibodies, the analogy for the antibody is going to be star-shaped cookies. You're having friends coming over because everyone's vaccinated and you're going to have a party outside and you're bringing star-shaped cookies. And so the mRNA vaccine would be as if your neighbor came over and gave you a instruction sheet that taught you how to make this star-shaped cookie cutter. And you already have all the ingredients, you already have all the tools and materials that you need. It's just you didn't know how to do it. And so now they're giving you those instructions. Cool, now I know how to do it. And you make it, and you make beautiful star-shaped cookies for all your friends. The other virus vector, the analogy I would use is instead of a message being brought where you learn how to create this shape, it's actually that your neighbor came over and they just gave you the cookie cutter. And so now you still make the antibodies. So long story short, you already have everything you need in your body to be able to create these antibodies. The vaccines are basically just giving you that additional instruction, that additional encouragement so that your body learns how to use what it already has to make those antibodies. And therefore, once you have them, if you encounter the virus, your body is prepared. It is armed and ready, already knows how to quickly basically neutralize or shut down that virus before it can cause a very severe critical illness and make you feel sick. And in doing so, it's less likely that you're going to be coughing and sneezing and shedding virus. So you're less likely to also get other people infected if you were to contract the virus once you're vaccinated. So really important both for protection of your own body as well as protecting those around you.
I love that analogy. I think that makes a lot of sense. And I think that a lot of times we hear like, okay, vaccine, right? But what does that mean? So I think that definitely makes a lot of sense. And it's something that we can all kind of take. And I think we all love cookies, right? So I think we can all kind of take that and apply it when, making a decision if we're going to get the vaccine or not. So thank you very much. That was a wonderful explanation. So Christian, as an IBD patient, I know myself, once I heard of COVID, I literally sheltered in place. And even now, still, I'm being very cautious about leaving and going out and just really trying to social distance. So what about you as an IBD patient? How has the pandemic impacted you and your health?
Well, thank you for that question. Yeah, it's been a very interesting year for everybody, but just as an IBD patient myself, it's been really hard trying to cope with not being able to see friends, not being able to see family for a very long time, and also just trying to be protective myself, wearing my mask, making sure that I was washing my hands frequently, doing all of the measures that the CDC told us to do, and it still are instructing us to do. So it's been really hard uh, to do those things, but not only just to do those things, but mentally as well. With the so much things that are happening within our world and with the pandemic, it's made everything a little bit harder as a patient. So I guess I've been hanging in there as best as I know how to, and trying to make sure I stay safe and keep on my medications to treat my Crohn's.
Yeah, no, I think that's a great way to say it. We're hanging in there, right? And that's all of us. So, Dr. Christian, so we know that vaccines can impact people in a variety of ways. So, for example, some people are receiving the vaccines and do not have any side effects, which that's awesome. While others, they have low-grade fever, body aches. And so, Christian, is this something that you've been concerned about when considering receiving the vaccine?
Yeah, that's a great question. Thank you so much for asking that. Yeah, I have been very concerned about it. Just hearing some of the cases and some of the reactions that some of my friends have had to the vaccines has really been scary to me. Because if these reactions are happening to normal people, then how is it going to happen, or what's going to happen with me being an IBD patient? And so, some of the things that really concerned me was how is it going to affect me? What do I need to do? What side effects am I going to have from it? I've spent a lot of time trying to look at the pros and the cons between the two to see what vaccine really should work for me and what would help me to uh, stay away from COVID and keep me safe and protect me throughout this dangerous new normal that we're in. And it's scary to really be in this time period, to live and to experience all these things and to see people dying from this disease. That also is another thing that just really just like bothers me mentally. But those are just some of the concerns that I've had.
Yeah, and I think those are all valid concerns. I think not even being an IBD patient, right? But just in, you know, people in general have concerns about the vaccine and just want to know how it's going to impact you. So I was the same way as a patient. Should I get the vaccine? Should I not? And I did. I made the decision to get the vaccine. I've had both doses of the vaccine. And so my first dose, I was nervous. And I actually remember once I got my first dose, I actually cried just because I literally was in tears. And it was a feeling, a happy feeling, saying, wow, this is one step closer to being able to see my family, to being able to see my friends, to being able to hug my mother, and some of my other family members that are older, right? So, the first shot was okay. I had a little bit of a sore arm. The second shot, I did have a few side effects, but it was nothing that was alarming or scary, nothing I couldn't handle. We're IBD patients, right? So we can handle a lot. And so some of the side effects I had with the second dose, again, I didn't have a lot of soreness in my arm. I did have a slight low-grade fever. I had some body aches, a little bit of headache. And the good thing about it, I had my second dose on a Friday. So I had the weekend, and by Monday, I was back up working. Didn't have to take off work or anything. So, hopefully that's reassuring, and again, I'm on immunosuppressants and things like that. And so far, I mean, I've been fine. I've had my second dose. It's been a month now, and I feel great. And I feel more protected. I'm still being safe. but you know, I don't have that nervousness about going out as much anymore, even if you have to go to the grocery store, the basic things. So, you know, that's a little bit about my experience. So hopefully that provides a little bit of comfort to you, Christian, and some of the other IBD patients if you are considering getting the vaccine. So, Dr. Quezada, can you explain what are some of the potential side effects of the vaccine? Like I said, we've heard a lot of side effects and everyone's different, but can you explain that and some of the impact that it possibly could have on IBD patients?
Sure, absolutely. And I really appreciate you both sharing, your experience considering and after having it as well. I have to just say that what you said, Kanika, really resonated with me too, because after I was fully vaccinated and both of my parents who are in both of their upper 70s, once they were also fully vaccinated, it was, I just like can't even begin to describe the relief and like sheer joy of just being able to hug and hold them again was just unbelievable. So if like for no other reason, I feel like that's like such an important and wonderful reason to do this. But it's true that, and I think it's really important to be very transparent and honest that yes, it's possible that you may have some side effects as a result of the vaccine. Although some people are lucky and feel nothing, some may have some shoulder soreness at the injection site. And like you mentioned, some may actually feel some more fatigue and weakness, maybe some chills, more generalized muscle soreness or fever. Just sort of really what that is your body's immune system reacting to the signal, right? Your immune system is at work. We're making the star-shaped cookie makers really, really aggressively, and that's good. So just, I think sometimes it's helpful to remind yourself what this means and that this is your body telling you that the vaccine is working and that your immune system is responding and is building your army, to fight off COVID-19. It's not that you're sick or not that you've contracted or come down with something now. This is sort of potentially part of the immune response. And also that you don't necessarily have to completely suffer through it without any support. You can take a Tylenol or two, to kind of help with those symptoms, make sure that you're well hydrated. And I think, again, knowing that this is a possibility, maybe being thoughtful about your strategy and timing and making sure that maybe you don't plan it the day before you have a big presentation to give or something like that, where maybe the next day, because usually they seem to take place within about 48 hours or so after the vaccination. And usually that is the extent. Usually by day 3, it's like nothing ever happened. And honestly, we haven't seen a big difference in our IBD patients versus the general population in terms of the likelihood of having a reaction or the nature or type of reaction. We really don't have a lot of information on that. So I would say that these reactions that we're talking about are just as possible to see in the general population as we would see in the IBD patient population. So doable, and I would just certainly say that this is a small price to pay, a small investment for the greater yield and good of knowing that you come out on the other side of that completely vaccinated. So I was somebody who I just had the shoulder soreness the first time. The second time, same thing. Both times it just lasted about 2 days or so. By the third day, it was gone. But actually what you described, Kanika, I have heard some people say that the first one seems to be easier than the second one. Maybe that's because your body was already kind of learning. And then by the second one was like, oh, we know how to do this, and kind of like had an even more robust response. So that's possible. And again, just planning ahead and making sure that you give yourself some space maybe for those couple of days, just in case you need it, is a good strategy.
Yeah, no, that's great. And I took I think Tylenol like twice, and it honestly was fine. So yeah, no, I'm happy that we're able to have this discussion and to share our experiences. So let's talk a little bit about recently the CDC and FDA recommended a pause on the Johnson & Johnson vaccine, COVID-19 vaccine, due to an extreme rare risk of blood clots. The pause has been lifted. But Dr. Quezada, can you share a little bit about, if our IBD patients should be concerned about this, and now that the pause has been lifted, and now that the Johnson & Johnson vaccine is being offered again?
Yeah, absolutely. So, I think the important thing to emphasize here is how very rare these cases truly were. So in order to see the initial 6, and then I know that there were an additional 9, I believe, that during the pause that also were found to have the blood clots. So 15 individuals, all who happened to be adult women under the age of 50. Out of 7 million doses that were given, right? So 15 out of 7 million is really, really rare. We're talking like 1 in 500,000 people. You're putting your life at risk more often just by getting in a car, to be quite honest with you. There are things that we do every day that are much riskier than something like this, than these odds. So honestly, this is why that pause was lifted. It was definitely shown to be exceedingly rare risk. Important to know about that, so that in the exceedingly rare event that there is a symptom or something that you want to reach out earlier, maybe rather than later, but certainly not an expectation. And honestly, I would say there are some benefits with the Johnson & Johnson vaccine. The fact that it's a 1-dose vaccine is actually pretty neat, right? I mean, we just talked about how you're potentially planning for 2 different times that you need to be careful and whatever. This would be 1 time, right? And actually, my mother-in-law got the Johnson & Johnson vaccine and was very happy, did very, very well. She's now about 6 weeks out from her vaccine. So, I think everyone clearly needs to weigh out their options and have these conversations with the provider. But I think it's appropriate that they lifted the pause, given how very rare these events were. So being aware of them is good, but I don't think it means that you sort of take Johnson & Johnson off the table. I think it's absolutely going to be part of what we need in our armamentarium for the public good, be able to fight this virus.
Okay, no, thanks for that information. And so there's a recent study from the UK that suggested that there may be a lack of SARS-CoV-2 antibodies production in patients taking infliximab, also known as Remicade. So Dr. Quezada, can you explain the findings of this study and what this means for patients who take Remicade or other anti-TNFs or immunosuppressant medications?
Sure, absolutely. Actually, I just got an email today, with the signal about this study. So it's a very timely question. And, I think that there are some important differences that we need to be very clear on, because sometimes when you see it like in a headline, you really have to read the fine print, and sometimes you really just have to read the study to really kind of understand who exactly was included, as far as which patients were being studied and how was it being studied. There was actually, before this one, there was a study where they were saying a similar thing, that and I believe it was also out of the UK, that patients on anti-TNF biologics seem to mount less COVID-19 antibody response. But then when you read further, you realize this was not in the setting of vaccination. This was in the setting of contracting COVID-19. So again, a different scenario. In this study that you're talking about, this was in the setting of vaccination, but again, in the UK, because they were having such issues with supply, they were actually already making recommendations to delay that 2nd dose, or even see if could they even just forego the 2nd dose altogether with those vaccines that actually are 2-dose vaccines. So they were trying to see can we get away with just 1 dose? If we give people 1 dose, can they mount a sufficient response? And so what they found in that study was that patients who were on anti-TNF biologics seem to be less likely to mount that response after one dose compared to patients who were not on an anti-TNF, but potentially could be on a different immune suppressant like in vedolizumab. What's important to note, though, is, again, one dose. There is actually another study, the Icarus study, coming out of the Icahn School of Medicine at Mount Sinai, where they're actually looking at giving the 2 doses and comparing based on which biologic medications patients are taking. And what they were able to see was in all the IBD patients who received both doses of the vaccine, that they actually did mount a robust immune response after their vaccination, which was awesome to see. And actually the majority of those patients were on anti-TNF biologics. So I think that's very reassuring. And I think that we'll have to continue to see how things evolve moving forward. We know from previous data with other vaccine data, like with the influenza vaccine, for example, or even the pneumonia vaccine, we know that immune suppression in general does seem to maybe be correlated with having a slightly less robust response of generating antibodies, that is definitely possible. What we don't always know is, does that necessarily mean that you're less protected? You know, sometimes there's a threshold of antibody that as long as you have like this, you know, general amount of antibody in your system, you're good. You know, whether you're up here or you're here, as long as you're over here, this is reasonable. This is good protection that you should get. So this is not a new not a new concept. It's just now applied in a new disease. But again, I think that that Icarus study is very reassuring, and it'll be great to see moving forward as we get, you know, more information and more data, you know, how things continue to evolve. So it'll be something we'll continue to learn about. But I think at this point, what's really important again is, from what we know, if you get both doses, or you know, your full vaccination, especially in those 2-dose vaccines, that you have definitely a good chance of mounting a robust and sufficient immune response.
Okay, and I don't know about you, Christian, but for me, that's reassuring as an IBD patient.
It surely is. It surely is.
Because I know when I first heard of that study, I was a little nervous, and especially someone that had already gotten the vaccine, and was also a little worried for, you know, people that have been considering getting the vaccine and hoping that that wouldn't prevent them or have them make the decision not to get it. So that's reassuring. So thank you so much for explaining that. Okay, so the COVID-19 pandemic, unfortunately, has disproportionately impacted communities of color. And I think we've all seen this on the news. We've heard of several cases and regarding this. So unfortunately, this has led to a greater need for communities of color to actually get vaccinated. So Dr. Quezada, can you share why it's important for IBD patients who are a part of communities of color to actually receive the vaccine?
Absolutely. I mean, I think you sort of answered the question in the question. I mean, I think that the important thing to remember is that, as you said, these minority communities, our minority communities, Black patients, Latinx patients, Indigenous patients, have been hit the hardest. You know, we've suffered more disease, more death. You know, we largely due to oftentimes our work, you know, I think because in our living spaces, the fact that oftentimes we are essential, we have to be out there, and sometimes we didn't have access to the best PPE, right? So for all of these various reasons, and then overlap with that, the fact that due to pre-existing you know, systemic inequities that result in these health disparities that we already know exist, that certain communities like our Black and Hispanic communities, as well as Indigenous, are more likely to have diabetes, high blood pressure, kidney problems, so are already, unfortunately, preconditioned to potentially have these risk factors for a more aggressive disease course. So we know that you know, in the Hispanic population, higher rates of infection, and our Black patients have higher death rates due to COVID, more severe disease. So So for all those reasons, and thinking about what I mentioned before, that when we get vaccinated, we make that decision for ourselves, but we also make that decision to protect those around us. And so when we get vaccinated, not only are we protecting ourselves, we're protecting everyone that we live and work and play and pray with, right? So I mean, it really is, and I think you mentioned before, like, IBD patients are resilient and have had to think deeply about complex decision making often, right? All the time, and thinking about medical treatments, surgical treatments. Like, there's so many things that you've had to really think about. And a lot of those times, especially I would argue with the medication treatments, those important decisions mostly impact you, right? Mostly they impact your body and your experience, your life. This is a decision that has all of that in it. And again, it actually also impacts everybody around you. So I feel like being a member of these communities of color, that we realize that we're also doing this not only for ourselves, but we're doing this to support our communities who have been absolutely hit the hardest. And I just want to share too that, talking about disparities, there are vaccination disparities too. So, the people who have been, are most likely to be vaccinated right now are white people in this country. And I don't think that's only and fully explained due to hesitancy. I think that the other part of the problem is access, and that we need to continue to do a better job of getting this vaccine out there to the communities that need them the most, to make it easy for people to get the vaccine. And I know that I think over time we're starting to get a little bit better about that. I live and work in Baltimore, and I know we now have some vaccine vans and buses that are getting out into neighborhoods that don't have easy transportation and easy access to come downtown and come to the convention center, for example. At my institution at University of Maryland, we're partnering with community-based organizations so that we can again help bring access to other areas of the community. Specifically, the example I'm thinking of is the Latinx community, and providing interpreter services, and really trying to, again, because otherwise, these patients either feel like they can't access it, or maybe an undocumented patient thinks they're not allowed to, or they don't even know how to navigate the system, or could have language barriers. So there's a lot of reasons why I think there are vaccination disparities. But by all means, for those of us who do have that access, who do have that opportunity, to remember that we're doing it not just for us, but we're doing it for our whole community.
And I think that's a really great point, Dr. Quezada. And I know I've seen in several areas, in several cities, that, for communities of color, they possibly might not have this access. And so I think that you raise a really good point that, some efforts sometimes need to take place in an effort to get the vaccines to these communities. So that completely makes sense. And I think, Christian, and I'm sure you can attest to this being a patient, but, I think you bring up a really great point, Dr. Quezada, when you say that as an IBD patient, we make decisions every single day about medications, or, which doctor we should see, based on if they are a good fit for us, which test, if we agree to have, whatever test that has been suggested for us. So I agree. So I think that this in itself is another decision, and everybody has a right to make their own decision. But I think it's important to ensure that, we're providing all of that educational knowledge that they would need to make that informed decision for themselves. And I agree that the final point is that not only are you protecting you, you're protecting others around you. And that in itself, I think is a beautiful thing. So I also know that many people still have concerns, right? So, and I think as it relates to getting the vaccine and receiving the vaccine, and I think that's normal, right? Because this is something new. I don't think any of us have ever been in a pandemic before. You know, so also communities of color have been concerned due to the historical perspective of vaccines, such as the Tuskegee Syphilis Project, in which Black and African American men were not provided adequate treatment and actually were used as experimental subjects. And so that in itself will create some concerns around getting the vaccine because of that historical perspective. According to the CDC, vaccine confidence, we've heard confidence as well as hesitancy, right? But vaccine confidence is trust that patients, their families and providers have in recommended vaccines, providers who administer these vaccines, and processes and policies that lead to vaccine development and recommendations for us. So Christian, as a patient of color, what concerns do you have about the vaccine and about receiving the vaccine? And are you, hopefully, you know, having this conversation has helped provide you with a little bit more confidence in making that decision?
That's an excellent question. Going into before this conversation and in prior thinking about it before being on this panel, I was always concerned about the access of getting it as a patient, and not only just the access of getting it, but how would my body respond? I know that I already have IBD. I know what kind of symptoms I have with IBD, but I was kind of scared of what kind of other side effects, like I mentioned earlier, would I experience if I were to get the vaccine. And so listening to Dr. Quezada talk about it and really just expand about it, I've just really been learning a lot just through hearing this conversation. And it's kind of put my heart at ease a little bit more with receiving the vaccine. One of the other things is I just didn't know how it worked best for me. I know that everybody's different, everybody's unique, and how everybody's body reacts to something is going to be different. So those were some of my concerns. I just didn't know how it was just going to all work out. But in listening to this conversation, it's given me some more confidence to really, as a Black African American, to step out of my bubble and really seek out how I can get this vaccine.
That's great to hear, Christian. And so, you know, now that you're at that stage where you're, you know, a little bit more confident, right, in receiving the vaccine, you know, what are your reasons for considering taking the vaccine? I know we talked a little bit about that, but, you know, everyone has their own personal reasons for considering to get the vaccine. So what would be your reasons for that?
Yeah, my reasons for that would be to be able to see my family and friends. There are a lot of family and a lot of friends that I haven't seen in a little bit over a year. And it's been sad to not be able to go and visit them, to hug them, like you mentioned earlier, to be able to be in their presence. Of course, with a mask still, to just be able to fellowship with them. And then one of the other concerns, it's just to have a peace of mind. Really, as an IBD patient, there's a lot of things that run through my mind constantly. And since this whole pandemic, there's been a lot of things that I've been worried about. It's like how I had to close my social circle in order to not only just protect myself, but to protect the people that I work with, protect my family and friends and the people that I love and interact with on a day-to-day basis. And so that was one of the other things that really concerned me, or that I'm thinking about. And then the chances of getting back to a new normal. It, man, this is crazy. I say this all the time. It's a crazy time to be alive. And I think about it as, when I get older, I'm gonna be able to tell my kids about this pandemic and just really like laugh it off and think about it and be like, wow, like I lived through that. But to be able to have a chance to feel like, whew, I can finally be able to at least travel or think about seeing family and friends that I haven't seen in a long while is it's very reassuring to me. And then the last and very important one to me, it's not only just keeping myself safe, but keeping the people around me safe. I really feel like that's very important, and I really value and love everybody that is in my circle. So I want to do my best to keep myself safe, to keep them safe, and so we can have a safer and better tomorrow for somebody else.
Yeah, and those are all wonderful reasons, Christian, and I think we all share, those similar reasons and sentiments. And I know me personally, I'm looking forward to getting on a plane and traveling. I love traveling, and I'm looking forward to that
It's
day when I can walk through the airport and not worry about COVID, right?
it's so weird that it feels like it hasn't been less than a year since I've been on a plane.
Right.
Like I remember that I was traveling to Connecticut at the beginning, at the hype of this whole pandemic, and
Hmm.
when I got back here to Huntsville, it was just like we're in the middle of a pandemic, and I'm like, I
Right.
don't know what to do. But yes, I agree. I'm looking forward to traveling. Maybe Hawaii sometime soon.
Hey, take me
Oh,
with
that
you.
sounds
I
good. That sounds great.
think once this is all over, we all deserve a vacation. So I
Yeah,
say, let's just do it.
Most definitely.
absolutely.
Well, so Dr. Quezada, we want to reassure Christian, I know he's considering getting the vaccine, which is good to hear. But we want to reassure him as well as other patients of color about the vaccine. So, is the vaccine safe for communities of color? I think that's the question that many people really want to know. Is this considered safe for all, pretty much everyone, and not
Right.
just a specific population?
Absolutely. And I want to start off just by saying thank you to Christian. First of all, it's just been an absolute pleasure to meet you. And I just really want to thank you for your authenticity and sharing your experience and your concerns. I think that this is what we all should be doing, with our loved ones, with our providers. I think it's wonderful that CCF has provided this space to have this conversation. And I want to really, really, clearly deliver the message that this vaccine is absolutely safe for people of color. It's safe for all humans, and absolutely for people of color. I love to amplify Dr. Kizzmekia Corbett, who is a Black scientist who happens to be a graduate of the University of Maryland, Baltimore County. It's an undergrad. It was instrumental in the development of this technology of the vaccines for COVID-19. This is a time where people of color are also part of the process of creating the vaccine, of it delivering the vaccine, and having these conversations. So it's so important that we all get the vaccine. I think it's even more important that people of color get the vaccine, and it's 100% safe. As safe for any person of color as it is for anyone who's not in that community. So by all means, don't let that be the thing that holds you back from getting the vaccine.
Well, that's great to hear. And so I've said this for myself, and Christian has said it based on why he's considering getting the vaccine. There's literally a sense of relief. You've even said that, Dr. Quezada, when you got the vaccine, right? You can
Absolutely.
actually take a deep breath,
Yeah.
right? And so, but we understand that people still might have concerns. So what would you recommend for those that are still concerned about getting the vaccine?
Yeah, I think that if people who still are thinking about this still have some concerns, first and foremost, I want to affirm you and say that's okay. That, we're not in fortunately, this isn't a decision that you have to make, right now necessarily. That you can continue to do what you're doing now and gathering the information and weighing out the pros and cons and having these discussions with your provider. Again, in the IBD community, I think this is something that we're pretty good at least we've had a lot of experience with in hopefully what we call shared decision making, that as a team, right, the provider and the patient are together sharing information, asking questions, discussing all the pros and cons, and then together coming to a decision of what is the best step, the best decision to make sure that you get to be healthy and live your life to the fullest. That's what we want for our patients. And so I think ideally, hopefully finding those trusted sources of information, because unfortunately there's also a lot of misinformation out there. I'm grateful to social media because it allows us to do something like this. I also recognize that there's a lot of weird stuff out there on social media that can sometimes be very frightening and confusing. And so again, just knowing who your trusted sources are, like your physician, like the information that you can find on the Crohn's and Colitis Foundation website and other resources like that, I think are really the places where you're going to get the information that you need, and just continue to be open to having these conversations. And hopefully once you have all the information, that you're going to be able to come to your decision shared with your physician for your health that ultimately will also benefit the whole community.
Great. Thank you so much, Dr. Quezada. And so, we're unfortunately at our time. I mean, this has been an amazing discussion and conversation. So I just want to personally thank both of you all. Christian, you as an IBD patient, you are amazing. And thank you so much. And Dr. Quezada, thank you for providing us with all this wonderful information. I know me personally, I've learned a lot myself, and I think Christian, he's clapping, so I think he's learned a lot as well. So
I've learned a lot. Thank you.
So I just wanted to give you an opportunity to see if either one of you all had any final words that you would like to say before we closed out tonight's program.
Yeah, I have some final words. Thank you so much, Dr. Quezada, for the kind words, and just being able to meet you virtually has been an honor and a privilege. And thank you, Kanique, for also the putting this together, organizing. This has been a phenomenal opportunity. And to the Crohn's and Colitis Foundation, thank you for placing an emphasis on making sure that minority patients consider getting the vaccine, and also know what risks they're at, as well as what are the pros to really getting the vaccine. One of the things that I would like to say is to patients that are considering doing this or considering getting the vaccine, is to make sure that you do your research. But not only just do your research, but also talk to your healthcare providers. Have a conversation with them. If you know somebody in your family that might have a medical experience, just have a conversation with somebody that can give you more information that you need in order to make sure you make the right decision for you. The second thing is to also consider those around you. Consider not only just yourself, but the people that you love, that you care about. Consider them as the individuals and trying to make sure that they stay safe. And then the third thing is just take your time to decide. Just take your time to decide. Remember that it's not a race, not a marathon. I'm pretty sure that they will have more vaccines available soon. And I hope that the underserved communities are able to get those vaccines and the resources that they need. And then my fourth and final point is just really stay safe. Continue to wear your mask, continue to follow the precautions that the CDC is saying to us to do. And ultimately, you should be all right. And thank you guys. Again, this just reassured me. This has calmed my nerves. Like my hairs in the back of my neck were sticking up. But now I am ready. I think I can make a decision whether which vaccine to go with, and what the future looks like after the vaccine. So I'm looking forward to doing that soon.
Thank you so much, Christian. That's awesome. Thank you. And Dr. Quezada, did you have anything that you would like to add?
Well, that's tough to follow. I think Christian kind of just summed it up, right? He said all the things. So really very much aligns. And actually, Christian earlier made a comment that also resonated with me a lot, and just talking about how, like, in future decades, we'll be able to tell younger generations about living in this moment, this unbelievable time, and being part of this. And I remember when I got my first dose of the vaccine, also feeling overwhelmed. Kanika, you mentioned that you cried when you got it. I felt so overwhelmed in that moment, so grateful. And also just thinking about that, like, again, being part of this moment, and also now being like, and now I'm part of the solution. The fact that things are getting better in large part is because we're getting vaccinated and people are getting protected and there's less transmission. So just to feel like I'm part of that now. I'm part of getting rid of this COVID-19. I'm tired of this thing. I want it to go away. And so this is the best tool that we have to move into a new future that is much brighter than the last year has been. So thank you, everyone, for your attention and for consideration. Listen to Christian. I agree with everything he says. And
listen, I'm trying to get to Hawaii. I'm trying to get to
yes,
Hawaii.
all right, let's all be in Hawaii.
Trying to get to Hawaii.
Love that.
Hey, I think that's a wonderful goal to have. So hopefully by, I don't know, soon, I'm not going to say a time, but soon we'll be on those planes, and this will be really an afterthought. So again, I just want to thank you both. You two have really been amazing and have added so much depth and information to this Facebook live chat. So we have to do this again in the near future. And but I truly appreciate your time tonight. And so we hope tonight's chat answered a lot of your questions for those watching us tonight about the COVID-19 vaccines, reasons why communities of color should consider getting the vaccine. And we will continue to update you on our website to provide you with the most updated information about the COVID-19 vaccine. And you can find all of this information, our COVID-19 resources, at www.crohn'scollitisfoundation.org/coronavirus. So if your questions weren't answered tonight, please do not hesitate to contact our IBD Help Center. Again, that information can be found at info@crohn'scollitisfoundation.org or 888-MY-GUT-PAIN. So again, special thank you to Dr. Quezada and Christian. And everyone stay safe, wash your hands, wear a mask, and we hope to see you again soon. Have a wonderful evening. Good night.
Thanks so much. Good night.
Thank you.